Thank you. I want to first welcome everybody that's here in South Florida that's at this program today. What do we hear from you all? Good morning. Our sponsor, our gold sponsors were EMD, Serono, and Sandoz. Our silver sponsor was Bristol-Myers Squibb. Our bronze supporters, Memorial Healthcare System, Sanofi, and Viatris. Our community sponsors, Mallinckrodt, Alexion Pharmaceuticals, and TG Therapeutics. And our exhibit sponsors, FlowMed Infusions, Genentech, First Choice Neurology, and Novartis. And let's give them a round of applause for being here to do this program today. Thank you. All right, Dr. Broz is a licensed clinical psychologist and specialized in clinical neuropsychology and rehabilitation psychology. Dr. Broz has extensive experience evaluating in individuals all ages with a wide variety of neurological conditions within medical, psychiatric, and forensic contexts. Dr. Broz has practiced in medical and university settings, primarily in neurology, intensive neurorehabilitation, trauma, and outpatient memory disorders. I'm not going to keep on saying on and on and on. Let's just welcome Dr. Broz, a neuropsychologist. Thank you.
Good morning. Thank you so much to MS Views and News for having me here today, and thank you for being here. This is a pleasure for me and an honor to be here today. This is actually my first official public service event from such a long time since the pandemic. You know, we've been off actually the mic and cameras and in-person kind of meetings. So this is kind of nice to have some social interaction again like this. For more than 2 years, I have just only focused on seeing patients one-to-one in our clinics. So this is wonderful. So I'm beyond thrilled to be here today. So thank you to have me. So again, we'll be talking about a very important aspect of MS, which I feel is very invisible to not only you guys at times, based on other factors that we will discuss in our speech today, but also, how important this is, and how we avoid even discussing this on a daily basis, which is mental health, in not only the MS population, but I feel like in overall society, this is something that is very diminished and needs to be provided attention to. So today I'll be discussing about how emotions matter, specifically in MS, the associated cognitive symptoms associated with MS in general, because this overlap, this tends to interact one with another. Also, how these specific symptoms affect you guys specifically, the impact that it has on your daily lives, in your family, in your social roles, and as well as, the coping strategies. So what we can do to address this kind of changes that matter to you. So why is it that, emotions matter, and why do we need to give importance to our mental health? Well, what we know is that it does affect our physical health as well. So we do have physiological symptoms, physiological reactions that come from how we feel, our emotions, not just the MS alone. Okay, so it does affect your motivation, your interest in engaging in activities that you enjoy doing. It affects other aspects of your life, as simple as sleep, appetite patterns. It affects the way you relate to other people in general. And also, like I mentioned before, even your ability to do the things that you used to enjoy before. And this is just basically based on how you feel. So first, I want to actually state something very important, that it is okay to address emotions and the way we feel. I still feel that there is a huge stigma associated to mental health in general. And oftentimes I see in my practice patients avoiding to talk about their emotions and their feelings. And then I find out that that's a major cause, of how they even think, which can be also affecting other aspects such as memory, attention, cognitive abilities in general, which we'll talk also in a moment. Then the overwhelming feeling of emotional stress as well. And I find that, with depression and MS, the most common symptoms lead to a sense of inadequacy, which also affects your self-esteem, your confidence level, And then also anxiety-related symptoms that stem from your own fears about not knowing or feeling uncertain about what was going to happen to you in the future. Like that feeling of not knowing in itself, it's very strong. And thinking about that produces a lot of anxiety-related symptoms. So that needs to be also attended to. So what is emotional stress? We all feel stressed out at some point in our lives over the course of the day, hours, minutes, and it is an overwhelming feeling that we feel. We may actually even exhibit physiological reactions from that, like fatigued, feeling tired, feeling slow. And it's not just coming from the MS, it's also coming from the emotional component underlying the MS condition. So this is something general also to the general population, not just to the individuals who have MS. So that leads to you not feeling good enough, that you can't do things that you used to do before. And like I mentioned before, it's an emotional cause, not just the MS condition. So dealing alone with the stigma associated with that is very strong. And that's one of the reasons why patients do not express how they feel in our practice. Some of the other major common symptoms that I find in our practice, and also it's been shown in research, is the profound sadness that, from feeling alone, maybe, the blame associated and the guilt associated with the condition, and answering, why me? Why is it that I'm the one experiencing this? Why was I chosen? I've lived a normal, healthy life, done exercise, ate healthy, so why me? So that's the profound sadness associated with the depression in MS. Also, the constant mood swings throughout the day, throughout the hours. Irritability, so feeling very irritated just for no reason at all, more easily than before. The feeling of not feeling good enough leads to helplessness and hopelessness. Having a pessimistic approach and outlook in life leads to that depression as well. Like I mentioned before, having no interest in doing the activities that you used to enjoy before, which is known as apathy, which is a big one in your case. And then lastly, employing ineffective coping strategies such as isolation and withdrawal. So withdrawing yourself from the social world and just keeping yourself in that cave, which is very dark, and you don't want to be there. That's the least you want to do. You have to go outside. You have to establish relationships. You have to enjoy life with what you have, basically adjusting to your limitations. And it has to be easier said than done, obviously, but there's got to be ways that you can help yourself and that you can allow us to help as mental health experts, that you can allow us to help you also in your journey. That's the least we can do. The other anxiety-related symptoms that we find pretty common in MS, it's just a constant worry, which causes a lot of apprehension, restlessness, nervousness, and it comes from those fears. So fearing the worst. So what's going to happen next? Am I going to be disabled soon? Am I going to be in a wheelchair in 5 years, 2 years, 10 years? So dealing with that constant uncertainty creates a lot of apprehension and worry in general. So the mood swings, again, overlap over depression and anxiety. Then you might feel that you do have physiological symptoms related to that is not stemming from a cardiological condition, anything like that, but it's more from your emotions, causing palpitations, sweating, and then a bunch of other symptoms that we know relate to other anxiety conditions, such as panic disorder, social phobia, and all of that. So then with all this, we experience intrusive thoughts, what we call, these thinking patterns that really interfere with the way that we think. So those are called intrusive thoughts. So sleep, that's one of the major signs that I do notice that patients express. It's having a disturbed sleep pattern. So obviously, if you're experiencing all these elevated symptoms of depression and anxiety, these symptoms will definitely affect the way you sleep, your pattern. So you could have insomnia, you can have interrupted sleep. And with that being said, it's important to establish a good sleep hygiene where you go to bed at a specific time in the evening, every night, all the time, with the exceptions if you do have social outings and things like that. But make sure that you guys do establish a good sleep hygiene routine where you dim your lights, your AC is colder maybe, so that all of that can put you to sleep at a faster rate maybe. So look this up. I'm pretty sure that there is enough literature out there that you guys can review at your leisure to help you with this, with the sleep. Because if we don't get enough sleep at night, our brains are not going to be rested the next morning. And you're most likely to experience daytime sleepiness, where you find yourself taking frequent naps during the day. So that's a sign, that we don't have well-rested brains. And that will lead to other issues that we will be talking in a few minutes, with regards to cognitive functioning. So the other common changes that are less frequent but are still very frequent, pseudobulbar affect, which happens, in about 10% of cases with MS. So these are uncontrollable episodes of crying or laughing, unrelated to how you're feeling. So I see it in my day-to-day practice, very frequently, where patients are talking to me about something very sad that happened to them, and they just uncontrollably laugh about it. And then this is treatable. You don't need to be feeling ashamed about it. There is treatment for this. And oftentimes this prevents individuals from going out and enjoying themselves and having normal interactions because they feel ashamed about it. But there's nothing to feel ashamed about it. You should be okay with addressing it with your neurologist. And there are medications to address this kind of mood changes, which are very abrupt. It can happen in any given time and moment, okay? In the middle of a conversation, in the middle of a trip, you're anywhere. Euphoria, to a smaller proportion, we've seen this. It's just a feeling of being unrealistically happiness. You're concerned about problems. It's almost like you are completely unaware, okay, of your issues. And this is more concerning because it's actually related to cognitive dysfunction in general, as this signals that patients may be experiencing poor insight. So insight and knowledge and information about your own limitations, okay, which is for us very important to know. So having in general a positive outlook about life, regardless of the situation, helps most people to remain at least somewhat emotionally stable. So emotional well-being can be nurtured and enhanced. There are ways that we can help ourselves to feel this way. And you're not alone. Always remember that. So focus on your own unique goals and achieve your own happiness. So discuss with your providers, what you can do to help yourself. And obviously, you all have goals and objectives to achieve in life, and don't undermine them. Just talk to your provider about what you can do to achieve those goals and being if they're realistic or not. And we'll help you along the way. So there are ways, obviously, that we know already on how to manage stress. Obviously, everybody's different, but these are some of the general kind of ways that we have learned that work. Deep breathing exercises, and this can be taught in an individual psychotherapy session. You can formally be taught how to breathe properly to reduce symptoms of anxiety. Meditation. So being aware of your surroundings, being well-minded, holistically, this can be learned as well during your sessions. Journaling, so writing things down, writing down how you feel, kind of like narrating that to someone else, is very therapeutic in itself psychologically. So you're letting your emotions out. And while you're doing that, in that process, you're actually achieving some healing for yourself. So it's very psychotherapeutic. Also engaging in your hobbies. So I know, obviously, that we do have limitations as to what we can do or not do. So check with your medical provider if you're able to do some exercises or not, or activities that you enjoy doing, and adjust yourself to what you're able to do and not do, and seek other options. If you're no longer able to play tennis or go swimming, or I'm pretty sure that there are other options that you can do to remain active socially, which is the key. Spend time with family and friends. That's very healthy. And that's a very different type of relationship than the relationship that you're going to have with a mental health expert or a clinical psychologist, which is going to be more formal, structured. You'll be guided by a professional on the things that they can help you with to follow certain strategies. But with family and friends, you can be open as to how you feel as well, but the kind of responses and approach that you will see from a family member is very different from that of a professional. Not to mention the information that you will not be disclosing to your family members just because you don't want to be a burden to them, or you don't want them to know how you really feel because you don't want them to be worried about you. So again, go seek professional help. Yoga, traditional exercise, we know from research that physical exercise does help the mind and the brain. So whatever exercise you can do, even if it is a stationary exercise, I'm pretty sure, you guys can have physical therapy come to the house if you're not able to fully engage in that. And just a little bit helps. Just keep the body moving, helps a lot with everything. And then my approach in our practice is to really find a solution-focused problem-solving approach, just because it's quicker within the medical practice. We tend to see this a lot. And it requires less psychotherapeutic sessions. It's basically you're in to learn about your problems, identify your issues, and try to find viable solutions to your problems that are quicker. So this is called the solution-focused problem-solving approach. And I find that it's very useful because it's short-term and it provides you with challenges as opportunities to grow. So it's not just a problem, but it becomes kind of like a challenge that you can grow from if we find, the solutions on how you can solve those issues that you're presented with. And it's from each success, you will enhance your feelings of competence. It will contribute to a better self-confidence about yourself and pride in general. So you're going to feel better about yourself. These are all positive reactions that you want to trigger when you're in a psychotherapeutic session. Again, with relationships, obviously, relationships affect all aspects of our lives. We do care about, our loving ones. And it's important for you guys to establish relationships. If you don't have close family members living with you, it's important for you to get out there and get involved in the community. To kind of like establish friends. You can go to community events, just like you're doing today. You're networking with others. I'm pretty sure that from here, you can go ahead and establish some relationships as well. You can share with each other. We have great online platforms that actually provide networking events, support groups, and I encourage you guys to get involved in that. And also in any community type of events that are in your area. These are all very positive aspects that you can focus on when you're coping with stress in general, whether it be depression or anxiety, but it's just healthy to keep yourself active socially. Family needs. So family members need help too. Okay, just, being next to, and not just caring, but being next to someone who has special needs do require assistance for these family members. So whether it be, individual psychotherapy, whether it be, which is more professional and more guided, like I mentioned before in general, which I feel that we all need at some point in our lives or even ongoing, if that helps you. But family members do need their help, do need their time for themselves as well. Otherwise, they'll be worn out and they can suffer from other conditions as well. So make sure to establish communication about this and go over your family needs as well. So now this leads me to cognitive functions, and this is really the forte of my practice. As Stu mentioned before, I specialized in neuropsychology, which has to do with the combination of how emotions and behaviors affect cognition in general, and how this impacts as well other conditions, or how these conditions, the MS, epilepsy, affect, the brain in functional ways or thinking abilities. So it includes our ability to focus, maintain, divide attention, learn and remember things, plan, carry out activities of daily living, the way that we think, how we approach problems, and how we reason in general. So you kind of want to know about this moving forward. As it was mentioned before, cognition tends to be affected as well. It could be related to a normal process of aging, as we all age and see changes in our hair, vision, skin. We also see changes in our thinking abilities coming from what is known like a normal process of aging, like I said, with some mild atrophy or related to a more clinically significant, deficit, which needs to be identified. So cognitive changes in MS does happen at a more frequent rate than in the general population. About 65 to 70% of patients experience these kind of changes. It's usually to a mild to severe degree, and it does follow a slow progression. In 10% of cases, it's severe enough to interfere with daily life. So it's not that common, okay? From a cognitive standpoint, for the cognitive dysfunctions to interfere with how you're functioning, it's usually your physical limitations coming from neurological issues. And then less than 5% experience underlying dementia. So there is definitely something there that you didn't know before, okay? A neuropathological process that was there that is not related really to the MS. And that's less than 5%. We encounter an underlying dementia. So with regards to the specific cognitive functions in MS, we find that about 30 to 60% has to do with information processing. So finding that you are slower, you're thinking slower than you used to before. And it has to do, obviously, with the neuronal mechanism in the brain that is not working properly. New learning and memory is affected in 40 to 50% of the cases. Complex attention, so your ability to shift attention from one place to the next. Multitask, executive functions, about roughly 20 to 35% of the time. Visual perception, word fluency, less common, 10 to 20%. And then widespread deficits related to more global impairments and severe enough in less than 10% of the cases. So obviously, the degree and severity of your deficits will likely be associated with the cerebral pathology that could be seen on an MRI or neuroimaging. So nowadays, we do have a specific MRI called MRI of the brain using neuroquant analysis. So what it does is that neuroimaging can actually take a percentage of those neuronal structures that we know to affect memory, and we can have a quantitative analysis of those structures. And I find it very useful, especially when we do repeat MRIs of the brain using neuroquant analysis. So that's looking as it relates to atrophy and the specific, percentages that we look for in every structure of the brain. So tissue loss, like we mentioned before, correlates to atrophy, especially in the corpus callosum and thalamus, which is like the relay station of the brain. So you'll see more slowing with that. So not affected is your intelligence level. So I see very highly intelligent, patients with MS in our practice. So like I said, intelligence level is crystallized and it's not affected by MS. Long-term remote memory, it's not affected either. Conversational speech, it's not. And just your reading comprehension in general is not either. So what to do about it? So address this kind of changes with your neurologist. And most likely you'll be referred for a neuropsychological evaluation with one of us, a clinical neuropsychologist. And what we do is that we put together a battery of tests to objectively assess your cognitive functions. And that entails not just memory alone, but the processes also underlying the mechanisms of memory and learning abilities. So is there an executive component that is leading to the memory loss versus a pathological memory condition that is stemming from a neurodegenerative condition. So maybe it's that we are not employing effective organizational strategies in learning the information. So what strategies do you use to learn a list of words if I gave you a list of words right now to learn? Do you have any type of strategies? Do you subcategorize those words into what categories? Do you use phonemic cueing to do that? So these are things that are learned, obviously. But if you're unable to do that during a formal neuropsychological evaluation, there are ways that we can help you with the recommendations that we give you so that you can improve your memory. And this is then not primarily due to a neurodegenerative condition, such as dementia, but it's more to the way that you are not organizing the information in your brain so that you can retrieve it later, okay? So we assess verbal abilities, language fluency, naming, abstract reasoning, executive functions, processing speed to a very detailed degree, visual, constructional abilities, perceptual spatial functions, fine motor dexterity. All of that is assessed during a neuropsychological evaluation. This tends to include a very lengthy session, but if we want to answer really your specific concerns, we can do this in about 2 to 3 hours. So our visits are very long. Some people can actually spend with you 8 hours if they wanted to do a very, very comprehensive, battery, which also assesses to a degree intellectual functioning and achievement level and all of that. But it could roughly be done in about 3 hours, 2 to 3 hours in general. And you can get all this relevant information back to your neurologist so that they know, what kind of cognitive dysfunctions you're having and to what degree. If there needs to be medication added to your medication regimen with a memory agent to slow down the progression of the memory loss or not. Typically, the disease-modifying treatment is enough to kind of like slow down the cognitive dysfunctions associated with MS, just because by treating the MS alone, you'll be actually treating kind of the cognitive symptoms associated with that. But if you do have an underlying neurodegenerative process, such as Alzheimer's or another type of dementia, then you may have to take another medication to kind of like slow down that process even more. But you can talk to your neurologist about that, and I'm sure that they can, answer your questions and provide you with the best possible treatment. And they will work closely with us, okay? So basically, managing the MS from a comprehensive approach is what we care about. So make sure that you guys are part of a comprehensive MS center that has it all, so that you guys can address all of your concerns. Because we like to have a holistic approach that doesn't just deal with the neurological symptoms, but also with the emotions associated with it, the cognitive dysfunctions, and then also employing, having dietitians, having people that can help you build a good nutrition system. And then with that, following obviously a healthy lifestyle, which we all know. Mental and cognitive health matters. So, and I'm pretty sure that that's in itself a big factor in your health overall, just because of the way that it impacts your life in general. So before you think about the physical aspects of the MS, also think about maybe it's a pseudo kind of thought process where you're thinking that you're having numbness, or you're thinking that you're having fatigue or tiredness from the MS in itself, and it might be coming from somewhere else, some psychological pain that you might be suppressing within yourself, and that you're calling for help, and you don't have the help that you need if you don't voice these concerns. So I really urge you to get attention for this, express it to your provider. So be happy to help you. If they're in this field, it's because they have a calling to answer, and they'll be, supportive of whatever decision you make. Thank you so much. This is the end of my presentation, and I'm happy to share a photo of my 1-year-old daughter on a pony. Thank you so much for having me, Stu, and then now I think we'll welcome questions.
Thank you very much. Thank you.
Hello. So thinking about the new medications for Alzheimer's, are there any off-label uses for MS and memory loss in MS?
The answer is no. No, not off-label uses. You can discuss it with your neurologist, but we don't really recommend, off-label medications to address, cognitive kind of issues, or even, for Alzheimer's, much less.
And we're talking about the new medications that have just come out for Alzheimer's?
Yes. The Quemby, you mean? So there are new medications, yes, and they're being tried right now at several of our centers. But again, you have to discuss that with your neurologist and see because there is a criteria, that you have to meet to be on these medications. And that one is for mild cases of Alzheimer's, and it has to be, again, identified early on in order for it to be effective. So if the disease is too advanced, then it's most likely that it's not going to be as efficacious.
Hi. At what age should MS patient obtain a neuropsychological evaluation, and then how often afterwards?
Great question. So as early as possible. Yes, we would like to have always a baseline evaluation. That way, when we continue to monitor you, and that can be with annual or every 2 years evaluations, we can always compare how you're doing. And I know the process sometimes could be tedious for some people, to undergo a full cognitive kind of assessment, but it's really not that bad. So patients that have actually undergone neuropsychological evaluations can tell you that it's not as bad. Sometimes they actually enjoy the process because they're learning about their cognition, their thinking patterns, how they learn, and how bad their memory is. So I think I'll be interested also in knowing, like every so often, how my brain is doing. So you could get that annually or even every 2 years if recommended by your neurologist. But we also like to have a baseline always. And to get it as early as possible is the best way, because we can always refer back to how you were doing back then, and then have a more accurate kind of diagnosis and treatment plan for you if we knew, how we were functioning prior.
Thank you. Person online is asking, can you talk about how to handle stress and anxiety causing MS symptoms that stem simply from the current world events?
So, like I mentioned in my presentation, there are a vast, variety of strategies that you can do to kind of like address the anxiety related. I mean, but we all feel, the anxiety with everything that is happening around us. How could you not? So that's why I stress the importance of seeking help professionally by going to a mental health professional for individual psychotherapy, so that we can actually teach you how to actually learn these effective coping strategies. Like I mentioned before, with meditation, with learning how to breathe in itself, building a good sleep hygiene, and just in the process in general of expressing your emotions. It's very psychotherapeutic in itself, but we can actually teach you strategies that are specific to your situation, which is very specific to you, to your problem, what you're going through, in a very solution-focused approach.
Hi, is this neuropsychological testing covered by Medicare for patients with MS?
Absolutely. It's covered by mostly all insurances.
Hi. MS diagnosis is a loss. We lost our previous life. Is there any book or source that you recommend to help coping with this loss beside therapy? And the other question that I have is about diet. Do you believe that the specific diet, can help improving the mental health, cognitively talking about?
Yes, for sure. So diet is a big portion of our lives in general. It contributes, we know, to a lot of other medical conditions, heart dysfunctions, So, of course, we need to give attention to that. So what I've read so far is following a Mediterranean diet. But if you wanted more specific kind of recommendations, you can go on the American Heart Association website, and they list a specific type of diets. And you can also go on a consultation with a dietitian a nutritionist as well that can help you build your own. So that could be customized to you, to your lab work. So depending on what you're deficient on or not. But in general, I think research supports a Mediterranean diet that is healthy for the brain. Yeah. And then books that you can read, there is a gazillion amount of books that are out there to address not just MS specific, symptomatology, like with the grief and loss, but in general, in dealing with general like grief and loss associated with any kind of condition that causes, disability or whatnot. I cannot think of one on the top of my head right now. I can get your information and most definitely get back to you on that. I have general ones, in my office, but just anything that could be helpful in teaching you strategies to deal with the stress and reduce anxiety symptoms, because that's primarily the root cause of a lot of the issues is the anxiety. Okay.
Thank you. There's an online question asking, what is your thoughts on long-term use of antidepressant Xanax?
Obviously, I don't like when I see patients that have been on for a long term on any benzodiazepine, because over time, they do affect memory and cognition in general. So, but if patients are presenting with severe depression, a lot of anxiety that they cannot control, and that's medically necessary, then by all means, you do have to take the antidepressant and the benzodiazepine. Now, I always try to recommend first, and those who know me that are my patients that are here, I also like to recommend psychotherapy first before going into any type of psychotropic medication, just because I know how that affects cognition as well. But if that doesn't work, you guys have to, take the medication. Sometimes even taking it over some period of time is enough, and you don't have to be on it for a long, long term, especially if you learn ways to help yourself in psychotherapy. But they should be conjointly used together. Like if you're taking antidepressants and hopefully anxiolytics and not benzodiazepines to treat anxiety, both together can exert a very positive impact in your life. But that's just based on a medical needs kind of basis.
Yes, hi there. Are there any supplements or vitamins that you recommend for mental health, memory?
Yes, but it needs to be, again, customized to your own individual needs. I don't like to recommend specific supplements just because sometimes even elevated numbers of those supplements are bad as well. For example, B12, B6. So these are kind of supplements that at times we take on our own over the counter. And then you come to find out with it when a neurologist sends you for blood work that those are elevated. And just having B12 alone elevated could cause cognitive issues. So I don't like to recommend any supplements over the counter, but always talk to your neurologist about these concerns that you have, these questions.
Next one is are there any meds used for MS cognition symptoms?
So what we know is that by treating the MS, we're also treating the related cognitive deficits, as we know. But if they start to progress at a faster rate and we're suspecting an underlying neuronal degeneration, then you may talk to your neurologist to see what options there are. Maybe they feel that it's appropriate to add a memory agent to your regimen. So that's up to them as well.
Yeah, hi there, Dr. Me again. Quick question. I had read that L-carnitine helps a lot with memory and Alzheimer's patients. I just wanted to know your thoughts on that.
Discuss it with your medical provider.
Thank you. Thank you.
Thank you. That sums up the questions. I'm coming up to thank you and...
Thank you.
Wait, don't go anywhere yet. Don't you see what's coming here? Oh my gosh. We have something for you as well, right? Thank you. Thank you very much for presenting today. Everybody, thank you very much for coming, and thank you all for being online. Bye-bye.